Hi guys, Dr. Deep Bot with Med School Tutors here. It's the summer before ERAS season officially begins, and we here at Med School Tutors thought we would take a minute to give you some tips and tricks as you get ready for this momentous occasion. Tip 1. Figure out what you want to do with your life. It should be your decision what you do for residency. For some people, this will be really easy. It'll be something they've known their entire lives. For others, like myself, it'll be a harder decision. You won't be sure if you want to be a surgeon or a medicine doctor. Think deeply about your clerkship experiences. Doctors are lucky that they get to practice in many different fields before they choose what they want to practice. Most other professions don't get this luxury. Think about your experiences, what you enjoyed the most, and also what you hated the least. Because everyone's career is going to have some difficulty. It's being able to withstand those difficulties that'll really get you through in the hard times. Also, don't be short-sighted with what you pick. Don't pick what you want to go into because it has an easier residency than others. Residency is a short, defined period in your life. Your career is the longer sum of all your work and dreams and goals. Now, after you've decided what you want to do with your life, now you have to go about getting it. Start working on your personal statement. The residency personal statement takes a lot longer to write than the medical school personal statement. All of us have always wanted to be doctors. The medical school's personal statement was about perfection. It was about cutting it down, getting into nice, short sentences, and not rambling too much about how badly we wanted to be doctors. Most people find the residency essay to be a lot harder. It's hard to decide whether you want to talk about your love for a specialty or love for medicine. Some of us don't have these perfect storybook reasons for why we wanted to go into a specialty. For some people, it could be, it's the only thing I liked. For others, it could be, it's the only thing I have a chance of matching into, given my board scores or maybe a red flag on your application. Obviously, this isn't the ideal way to craft your personal statement. What you should do is go ahead and just start now. Start with a draft. Write something. Get it down on paper and pen. Show it to as many people that you trust as possible. If you can, show it to people with a little bit more experience than you. People ahead of you in this game. At your phase of the game, it can be kind of hard to see the big picture. You can get tunnel vision through medical school and clerkship experiences, and that can come out sometimes in personal statements. It's always good to get a second opinion on your personal statement. The more eyes lay on it, the better. Next, ask for letters of recommendation. Now that you know you want to apply into 3 specialties, you're going to need 9 letters of recommendation. Do not be afraid to ask your preceptors for recommendations. Remember how hard you worked on clerkships? Remember showing up at 4 in the morning to track a patient's ins and outs? Remember reporting on their every subjective complaint, having those difficult conversations with family members, and following up on lab values, and getting outside records? You did that to impress the person you were working with so that they could write you a letter of recommendation. It is the expectation of academic faculty that they will be asked to write letters of recommendation, and many of them appreciate doing so. Try to identify the mentors that were the best teachers to you and the ones that seemed most invested in your future and your success. It's always better to go with someone who knows you personally than some big fancy name who only worked with you for one day. Great. So now you've got some of the hardest things done. You've picked what you want to do with your life. You've started on a personal statement that explains why, and you've gotten the letters of recommendation that you need to apply into the specialty. Now it's time to craft your CV. Crafting your CV is an important step in preparing for ERAS because the ERAS application will really be your CV transcribed. Again, on this step, make a pass on your own in your own CV, focusing on accomplishments from college onwards, mostly during medical school. Only your most important college accomplishments should really still be there. Remember, never put something on your CV that you can't talk about. If you can't talk about it and someone asks you about it, that's the worst possible outcome for something on your CV. Very rarely is something on your CV going to get you an interview and you're not going to be asked about it. So if you can't talk about it enthusiastically, with warm memories and good experiences, leave it off. After you've done your CV, your ERAS will eventually open, and you're going to have to put all these things down into ERAS. If you've done a good job on your CV, had a good group of eyes proofread it, made sure there's no errors, made sure everything that you really want to be in there is in there, then filling out your ERAS should be a simple step. Next, you're going to want to identify the schools you want to apply to. Identifying schools is a deeply personal choice and is very much based on an applicant's strength of application, regionality, long-term goals in life. Where you apply will obviously end up dictating where you go. Look at the places that people from your school have matched before. If your school tends to have a very regional match and you want to go somewhere outside the region, you need to identify that now in June so that you can do an away rotation. Always do away rotations. Never take advice from people who tell you not to do them. If you want to work somewhere, what's a better way of figuring out if you two are a match than going and working there for 4 weeks? It's like dating before getting married. I've never heard someone say don't date someone before you marry them. And that's why I can never agree with any advice that says not to do an away rotation before you apply to a certain residency. Great, so we've gotten our letters of recommendation, we've done our personal statement, we've made our CV, we've fixed our ERAS, we've picked which programs we want to apply to. Now it's time to hit submit and send the applications out to the universe. Once you apply, you'll have a nice 30-day waiting period where you won't hear from schools probably. Don't get too anxious, that's pretty normal. This is a great time to start practicing your interview prep. Get ready for the questions they might ask you on interview day. It's great to prep with someone who's either interviewed someone before or has gone through the process themselves. They'll give you all the key little insights into what can get asked on interview day. It's obviously different for different specialties. I interviewed in surgical specialties, in medicine specialties, and pediatric specialties, and each group of people had their own unique flavor and approach. So depending on what you go into, you're going to want to practice in that scenario. All right, guys, so that covers the main 7 basics of an ERAS application. We at MST wish you the best luck as this residency application season approaches, and if you ever need a second set of eyes, a second set of ears, or an outsider's opinion, we're here for you. Thanks.